As parents, we want our children to be happy, to feel safe and loved, and to have a natural sense of connection as they grow toward a meaningful and fulfilling life. As parents of children on the autism spectrum, we also know there can be significant challenges along the way, and there are more of us seeking answers than ever before.
Well, I started out in denial. Our son spoke, maybe the word shoes at around 9 months or so. It really wasn't until he was getting towards age 2 and wasn't speaking again that we became concerned and brought him to our developmental pediatrician. And then it kind of all came crashing down. So this was the problem. They were telling us our son, who was standing in a corner and biting himself, should be institutionalized. And yet that's what the track was that we were slotted into almost automatically. And I had seen lots of kids in institutions. I've been working with this population for about 11 years. And, frankly, it was horrifying to think that this was going to be his fate. It wasn't until maybe age 2.5 when, months after, my advisor had given me this paper by Stanley Greenspan and Serena Wieder. And so we went to work with Drs. Greenspan and Wieder.
Unlike applied behavioral analysis, which focuses primarily on the visible behaviors and symptoms of autism, the developmental model treats the whole child, addressing the underlying root causes and challenges. Instead of judging the behaviors that children present as good or bad, the developmental model sees these behaviors as attempts to communicate. By joining children where they are and sharing in their world, we have the opportunity to learn and establish greater trust and understanding for everyone involved. Shared stories and collaborative play help children learn to understand their own emotions in the situations where they happen, so they're better able to relax, communicate, and connect with others in everyday situations.
My son was being bothered by my daughter, who was just, crawling at that point, and she took away his Thomas the Tank Engine toy, and he took it back and said, "Marty, go on mama." He did another sentence. Our jaws just dropped, and we realized, it all clicked, that putting together this idea of acting on something and pulling together your abilities because you care about something is exactly what we needed to be doing with him.
The sessions are built on what the child loves and enjoys doing naturally. We help everyone play and have fun, and children look forward to the interactions. There are proven developmental techniques at work here. Together, therapists, children, and parents are building the foundation for critical social and emotional skills. And it's through these interactions that children discover the joy of making these connections and sharing the experience.
Gradually, over the 3 years we worked directly with Drs. Wieder and Greenspan, we became more able to connect with him. He became more comfortable in the world. The OT helped tremendously. The speech therapy was incredibly helpful. He was using words in ways that were more helpful to him and to us.
At Positive Development, we provide developmental therapy through a team of trained professionals and paraprofessionals with a strong emphasis on your role as a parent. Our therapists give you coaching to build developmental concepts into your everyday interactions.
Developmental approaches are effective. I know it from my son, from the patients I've been treating for decades, from my colleagues' experiences, and from solid evidence-based research.
Your Positive Development Care team consists of a mental health therapist, an occupational therapist, and a speech therapist. They work together to assess your child's needs, create a custom treatment plan, and deliver coordinated care. And you'll have a care coordinator as your main point of contact from the very beginning. Our coordinators take the stress out of managing schedules and figuring out insurance. We want to make your experience as convenient as possible. Therapy can take place in an office, online, or in your home. We figure out together what works best for you and your child.
3 years from you should institutionalize him to kindergarten. Not bad. And by the way, he did end up going to an institution, but it was an institution of higher education. It was engineering school. And he's a great engineer now. our developmental approach is a positive approach. Your child isn't wrong or bad. My child wasn't wrong or bad. He was having trouble being calm and navigating a challenging world. And our job is to help your child to be calm and to navigate our challenging world. I had a choice, and you have a choice, and our team can help.